Hello, my name is Dr. Tom McMahon. I am a partner with University Gastroenterology. We are a single specialty group with 4 locations throughout the state, and our emphasis is completely just on gastroenterology and endoscopic procedures. Today, we are here to discuss colonoscopy, what it is, and how important the preparation is in order for us to get a good examination done on your colon. The procedure of colonoscopy is one that has been around for many years now. It is safe, effective, and our most important tool to try to reduce the incidence of one of the most common cancers, which is colorectal cancer. I'm going to briefly discuss how the procedure is done and then focus more on the preparation which our patients have to do in order for us to get the best look inside the colon to find and remove all the precancerous growths that may be present. This is the instrument that we use called the colonoscope. It is a thin, flexible instrument about 6 feet in length. It enters into the colon from the rectum and advances through the entire colon. We can get the instrument where it needs to go by manipulation of dials that turn the instrument through any turns or twists inside the colon. There is a light on the end of it transmitting an image onto this screen. One can see from looking at this how beautifully we see all the details now of my hand with the glove on it, and that corresponds to how well we see things inside the colon. There is a channel through the instrument through which we place devices to remove polyps and to obtain biopsies, and again, that is all visualized on the TV screen. We do all these procedures in our 4 endoscopic centers, which are located here in Portsmouth. There are 2 in Providence and 1 in East Greenwich. The procedures are done with various levels of sedation in order to make all of our patients comfortable. We have the capability of using moderate sedation, which includes a narcotic and a sedative, and we also have anesthesia services to provide deeper sedation for our patients who may require that. I would like to briefly review with you the instructions for colonoscopy preparation. These instructions are all found on our website. The first issue is that you must arrange a ride on the day of your examination. You will be given sedation and therefore should not be driving. If you have diabetes, you must speak with your primary care physician or endocrinologist for diet and medication instructions. Please let us know if you are pregnant. All of your medications should be listed before you come in for your procedure. If you must cancel or reschedule, please call our office as soon as possible beforehand. There are instructions to consider regarding medications before the procedure. Anti-inflammatories such as Advil, Motrin, Celebrex, and ibuprofen can be continued. If you are on blood thinners such as Plavix, Pradaxa, Coumadin, Effient, Lovenox, you must speak with your primary care doctor or your cardiologist in order to be given instructions as to when to discontinue them before the procedure. We do not want to have blood thinners in your system if we are doing a colonoscopy and removing polyps, because we do not want to have a higher risk of bleeding after removing the polyp. If you take any form of iron, please stop this at least a week before the procedure. Likewise, fiber supplementation, high fiber foods should be stopped at least 5 days before the procedure. On the day before the procedure, the instructions begin with no solid foods. You can have any liquid except liquids that are red or purple. Alcohol should not be taken before the procedure. Acceptable liquids include black coffee, tea, water, apple juice, ginger ale, 7-Up, Gatorade, vitamin water, Crystal Light. You must drink the entire bowel preparation as instructed by your physician, and we will get into that momentarily. On the day of the procedure, we have people stop drinking liquids 6 hours prior to the examination. You can take your morning medications with 4 ounces of water up to 4 hours prior to the procedure. The specific instructions for the preparation that you are to take will be given to you by the staff of the physician performing the procedure. They are all contained on our website. In general, we no longer use the big gallon jug that everyone feared, as we have simpler preps that do the same clean out. Generally, the preps begin with taking 4 Dulcolax tablets, and then later in that day, we have you use a combination of either Miralax with Gatorade or sometimes citrate of magnesia. The preps can be administered either all on the same day, the evening before the procedure, or sometimes we have people do a split prep, especially if their procedure is a little bit later in the day, where half of the prep is done the day before and the evening before, and then the rest the morning of. That preparation appears to have the best success in terms of the best clean out of the colon, providing the best opportunity for us to have good visualization throughout the colon. So whatever instructions you were given, you can follow. They are written on our website, and you will have a copy of those prior to your procedure. You will obviously have to pick up the laxatives before you start the preparation. There are a number of questions that come up typically that I'd like to answer, and one question is, what is the clear liquid? I did talk about that, including apple juice, ginger ale, Gatorade, basically anything that you can see through. We don't want creamy substances, we don't want people to have milk, but anything that you can see through is good to take. Water in any volume is always good to take. The question about red liquids being avoided is basically to make sure that we don't mistake the red jello for blood inside the colon. As mentioned, the question about taking the medicines the morning of the procedure is very important. We often have people coming in with high blood pressure who did not take their medicines, and we have to struggle with their blood pressure being high before and during the procedure. So if you have high blood pressure as one of the most common medicines, you should definitely take your blood pressure medicine before you come in. People ask questions about trying to make the preparation taste better. My suggestion would be that you use whatever you like. If you like a lemon flavor, use that. Some people think that rinsing your mouth with water or a mouthwash or hard candy may get any bitter taste out of your mouth. The goal for the preparation is to make sure that you are able to consume the entire preparation and have the results which we desire, which is basically having stools coming out that are as close to clear or at least clear yellow. If you develop nausea or vomiting during the preparation, it does not mean that the procedure has to be canceled. Typically what we suggest is that if you get sick halfway through, that you stop the preparation for a few hours. If your procedure is going to be later in the day, the next day, you may do better with stopping it for that evening and then resuming it early the next morning, and you may be able to get the rest of the prep down and complete it and have your colon cleaned out. In summary, we feel the colonoscopy is a very important procedure. It can help to prevent one of the most common cancers by removing precancerous growths at the polyp stage. The general screening guidelines would suggest starting at age 50. Recently, the U.S. Preventative Task Force has suggested that we start at age 45, again suggesting that this is a very preventable disease that we can take care of by early detection. If you have any concerns, please feel free to contact our office. We offer the direct colonoscopy procedure where we do it right in our office. If you have concerns and want to speak to us beforehand, you can always make an appointment to discuss the procedure with us more thoroughly. Risks of complications such as bleeding or puncturing the colon are extremely rare, and we feel that this is a very important examination to prevent a common cancer.